Hi there everyone, it's me again, Dracula's daughter. Got my hair up today as you can see, so looking more of a Dracula's daughter today. We can see my tattoos anyway, which is nice. So that's the only time you can see my tattoos is when my hair's up. So I'm going to get another one soon, well one day at the back of my neck as well, so which would be nice. So anyway, the reason why I didn't do a video yesterday, I got so tired. Bloody metal chairs, honestly. Oh, and pardon me, it's bumping into people and having cup of tea and chatting to people and even strangers and whatever, you know, but dogs and animals and whatever like that. So by the time I got home, I was so tired, I just crashed out. But anyway, but I'm here today, so you thought you got away with it, didn't you? I'm not that kind, I can tell you that for nothing. But anyway, so on Friday, on my way to my GP surgery to get a diagnosis of exactly what's wrong with me, I bumped into a friend which I hadn't seen for such a long time, and just talking about his children and the mother of his children, who I know as well. So I've known as long as I've known him. He was talking about his kids. Do you know? So it just shocked him because me and my ex-husband used to babysit them when they were about 4 and 5, and his son is in a relationship. So is one of his daughters in a relationship, all loved up and everything. And do you know? So it just goes so quickly. And the older you get, I feel the quicker time goes. But anyway, so that's besides the point. But I was just talking about his ex, who's out living in France now. Was just recovering from stage 4 breast cancer, which shocked me. So you know, so it's just one of those things, isn't it? You know, so, cancer does not just discriminate against anyone. You know, so it's just there. You know, so, and this video will cover each and every one of us. It will cover men as well as women or non-binary, whatever. I'm talking males and females. That's what I'm saying about now. All right. So if you get offended about the titles I use, you know, so wake up and smell the coffee, snowflakes. It's like, at the end of the day, it's us. All right. So honestly, it's just one of those. But anyway, so going back to that, today I'm going to talk about breast cancer and how to check for lumps on your breast and the best way to do it. People think, oh, just sit there and just go whatever. No, you don't. Best time to do it is in the shower, because your skin is more relaxed and with the warmth and everything like that. So you'll be able to feel it. So, I was told 7.5 years ago, I think it was, 8 years ago, by my then GP how to check my boobs when I'm in the shower. That is the best time to do it. So, and they say to check at least once a month, but I personally think you should be done much sooner than that, because you just don't know, do you? So, because it can happen just like that. So, but anyway, so without further ado, as they say, I shall endeavour to show you how to check your breasts, and this goes for boys, girls, men, women, trans, straight, gay, bi, whoever you are. Please check, and the best time to do that is in the shower. I'm not going to take my top off. I'm not going to show my boobs. I'm not going to show my bra, or go topless. So those of you who were hoping or thinking, oh God, here she goes showing off her boobs again. No, I don't do that. So anyway, so I'm going to do it over the clothing, and as you can see, I do have biggish boobs. So and here we go. So I shall start now. I may look a fool, I may look like an idiot doing it, and I might feel like an idiot doing it, but it could save your life. So, and that's the main thing. So what if you're going to look like an idiot? As long as if it's going to save your life, do it. So anyway, so here we go. Right, in the shower, he told me. So as you can see, I got my hair up as well, so out of the way. So he said, put your arm up like that, the back of your head. So I'm sorry, this is the bad arm. Sorry, I've got to do this side here because I've got fibro and this is right. Do it here. He said put your arm up like that. He said in the shower. He said get your hand. He said and get your palm like that and just squeeze like that. Just squeeze with your fingers in like that. Get your palm on the boob and just go around like that. Up into the armpit, see if there's any lumps there. Right. Then back around. Do it both sides. Round and around like that. Go around and do it. And literally just press. You can press as hard as you want. Can't feel any lumps there at all. No. He said you can press as. I'll do this side now. Same again. Like that. Just press with 4 fingers together. Palm like that on the boob. Press in like that with your fingers. Up to the armpits because you've got nodes there. Glands there. So whatever. So it's okay. So this arm's killing me now. So just go around. Go around and round and round like that. And just feel. Anything. So even on the top bit here. Around the boob here as well. So. Alright, so just do it like that, and every time you have a shower, basically. So I would say once a week. I would say once a week because you just don't know that really hard. I did that really hard then. But then again, do it as hard as you like because maybe the lump could be underneath somewhere. And you might not be able to feel it at first. So if you just press really, really hard with your arm up. Do it that way, and if there's any changes in the boob, in the breast at all, or the nipple, go to your GP and get it checked out just in case. Better be safe than sorry. Any discharge coming out of the nipple that might have a little bit of blood in it, go to your GP and get it checked out. Any lumps, get it checked. It might not be cancerous. It could be just a fatty lump, but still, again, better be safe than sorry. If they think that you need a biopsy, by all means go for it and take it from there. But we all have fatty lumps on our bodies. I've got one on my arm, and when I first had it, I got panicky. So on my left arm here, I got panicky because I still feel it there now, and I thought it was cancerous and everything, but it's not. So so if you feel a lump like that anywhere on your body, and it hasn't been there before, then please go and get it checked because, like I said, so cancer does not discriminate against anyone. It's so easy for us to say, "Oh no, it's not me. It's not me." So it's not going to happen to me, but you just don't know, do you? So it's happened to a friend of mine, and another friend of mine died a couple of years ago. He had bowel cancer and travelled to his lungs and everything. And last time I saw him, it was about 6 weeks before he died. He said that he'd recovered from it. Another friend of mine died of liver cancer. No, kidney cancer. She went into hospital. I saw her and had a cup of coffee with her, and then 6 weeks later, I got told that she'd passed, which was a shock. Can you imagine standing in the middle of a big superstore, and one of the workers there, which is also a friend, turns around and tells you that our mutual friend had just died. So, so it's just absolutely horrendous, and I still miss her to this day. She was such a character, and both of them were characters, so in their own right, so bigger than life. And it's the same with my mate that's out in France. He's just recovering from cancer, stage 4 cancer. She's larger than life as well. So hey ho. So yes. So this goes for everybody, that males and females. That because even men can get breast cancer, even though it's rare. It's one of the most common cancers. In women, breast cancer. Get it checked out. you know, any changes in the areola or the nipple or even the breast itself, if it's gone hard, if it's tender or grown bigger or shrunk, or dimples in the skin which would never work, like dents in the skin that weren't there before. Please get it checked and take it from there, and take it one step at a time, isn't it? So yes, so I don't know what else to say about it really, because I'm dumbfounded, you know. So I suppose that the older one gets, the more people one knows that are going to suffer from something like cancer, things like cancer or whatever. So I just, you know, so I'm struggling for words about it, because well, there are no words to express, is there? Are there? You know, so how you know, so when you know somebody's got cancer or had cancer or suffering with, you know, suffering with that awful, god awful disease, you know, so what can one say? There's nothing one can say. Just be there for that person, you know. So and above all, look after yourself. And this is a very, very short video today. It looks like it's going to tip it down, so that's why I could come rushing out today to do it. I couldn't do it yesterday. I got so tired yesterday, and by the time I realised it was about 8 o'clock in the evening, I thought, no, I'm not going to do one now. So it's not fair doing one at that time of the evening. So I thought, oh, I'll leave it until tomorrow, which is today. So here we are, and by all means, check your breasts, check your body for any lumps, and if you've got any moles and they change colour and everything, you know, or change in size and whatever, get them checked. Anything, honestly, you think has changed. Our bodies change anyway with age. It does. They do. Things get saggy, things go south and everything. But and that happens slowly. But with things like cancer, it can change literally just like that. So just get things checked, and if you still don't feel right, keep pushing and keep pushing and keep pushing. It was with a friend of mine, so she found out too late that she had kidney cancer, and 6 weeks later she was gone, you know. So I do know quite a few people that have had cancer come through. I know quite a few people that have had cancer and died. So you know, so but anyway, so get it checked, get your body checked, even and for us girls. Now I haven't done it, and I'm so naughty. When I turned 50, I got my first ever letter to go and have a mammogram, and I didn't go. I should have, because it is really important to get yourself checked. And we are lucky in this country, again, lucky to have the NHS. Oh, pardon me. Oh, dear me. Sorry, it's that bit of sacking I had. Honestly, Marks and Spencer's and their sacking, it's all repeating me all the time. Bit of roughage, bit of fibre. But anyway, so yes, so get yourself checked, and we are lucky that we have the NHS to help get us checked if we do worry. I know that sometimes we do get pushed aside to go, oh no, it's nothing wrong, it's not, it's your imagination and things like that. But do keep on pushing. If you think there's something wrong, regardless of what it is, then keep pushing. It took me 15 years to find out on Friday that they say I have fibromyalgia. It was everything else but for the last 15 years. Same surgery, and they've moved twice. Well, they've moved once from one building to the next, and in that 15 years they finally turned around and told me on Friday that yes, I do have fibromyalgia. So you know, it only took them 15 years to diagnose me with that. So that is a bit of a relief for me, because if you have an active imagination as I have, a very hugely very active imagination, 9 times out of 10 I can't even sleep because my mind is just racing all the time. But you know, so it is a lot off my shoulders and a lot off my mind, actually knowing that it was nothing more serious, if you know what I mean. So so yes, please get yourselves checked, check yourselves, and any problems, go to your GP and then take it from there. And if they poo-poo it, then get a second opinion if you are still worried. Don't, you know, if you are really worried, don't take their word for it, because it could be anything. You just don't know. You know, it could be something or nothing. We just don't know, do we? So, but anyways, our own health is paramount, and there's a lot of people out there that do selfless work and selfless things for other people, and they don't even bother checking on themselves, checking in on themselves, and making sure that they're okay. But you are the important one. You know, you have to look after yourself first, paramount. You are number one. You are worth it. You are. You know, so if you are head of the family, and you keep looking after the family all the time, and they don't, oh, he's got a bottle, I don't know a bottle of what, but I'll see in a minute, plastic bottle or something, I can hear him chewing it. But anyway, so yes, so get yourselves checked, make sure you're okay, get yourselves a blood test once a year, a whole body MOT once a year, I'd say, with your GP. You know, they say you don't need it until after you're a certain age, you know, until you're a certain age. But personally, I'd go for it once a year, every 18 months. Get blood tests, get weighed, get measured, and everything. You know, so go for it. I did mine 3 weeks ago, and I've lost an inch in height. I was 18 stone 1 pound, which is the heaviest I've ever been in my whole life. Honestly. Decades ago, I think I was only about between 8 and 10 stone. That was the average. I went in between 8 and 10 stone, and well, there you go. I'm literally double the person I was. So people say, "Oh, it's age. You get older." No, it's not age with me. Believe me, it's gluttony, kids. It's gluttony. Too many cakes and biscuits and sweets. That's what it is. That's what happens. It's okay now, youngsters that are out there like chomping away on these cakes and biscuits and sweets and everything, and chocolate and whatnot. Going, oh, I'll never put on weight. Oh no, look at me, I'm still skinny. Wait until you hit 40. I can tell you now. Once you hit 40, things start going like that. So you might be lucky and have a very active metabolism, which I envy you for. Mine's so sluggish, it's unbelievable. It's like, I think it's going backwards, I think, but there you go. But yes, so get yourselves checked over. I'd say at least once a year to 18 months, get the full works done. And if they say you don't need it, just push them, because just push them. You know, no, nothing about, you know. So, oh no, especially if this is in your family, of diabetes in your family, or history of heart attacks, or history of strokes, history of cancer, history of this, history of that. No, it doesn't matter. It doesn't matter at all. Just get yourselves checked once a year to every 18 months, and then just go from there, you know. So if you get a clean bill of health, more power to you, kid. But if there's something wrong, they can treat it there and then and take it from there. So do it exactly. So you know what to do. Get yourselves checked. Get yourselves okay. Get yourselves an MOT every year to 18 months. So and here in the UK, we are lucky that we have the NHS to be able to do that. So it's not going to cost us anything. But in other countries, you have to pay, and you know. So, but in some countries, it's very cheap anyway. But the USA just apparently is very, very expensive. It's extortionate in the USA, I think. I've been told anyway. It's extortionate compared to other countries. I think it's one, if not the most expensive healthcare place in the world. you know. So, but anyway, so I digress again. But like I said, go and get yourselves checked out, checked over, and a proper MOT, and get it all done. Just think of your body as a car, and you are the driver of that car. So you take your car to get checked every year, don't you? MOT every year, every 12 months. So why not do it to your body? And don't say, oh, but it says, you know, go after a certain age, like after 60 or 75 or whatever. If you want to go and get a proper check over, go for it. Once a year, once to 18 months, and look after yourself. Eat healthy, be healthy. You don't have to run around and exercise all the time and go to the gym or go jogging or whatever like that. There are other things that you can do that would keep you healthy and fit and whatever. And one of them is a change of diet with most of us, which is what I'm doing. And I'm doing quite well actually. So funnily enough, I haven't weighed myself since the last time I got weighed. So and I put on 2 stone in about 7 years, which is not bad going really, I think, but hey, 2 stone's 2 stone, isn't it? You know, so it could be half a teenager, you know. So, but yes, so just be you, get fit, get healthy, and look after yourselves. And that's all I have to say on this matter today. So have a nice weekend. Enjoy the rest of the day. It's very cloudy here. I think it's going to tip me down in a minute. So I better rush in. So speak to you soon. Bye bye.